Hi, I'm Kayla,
And I'm Myra.
and our topic today is thalassemia.
So, thalassemia is basically an inherited blood disorder that is caused by having less hemoglobin. This just means that you will be more prone to be anemic and be extremely fatigued.
So this is how thalassemia can affect your blood cells. So on the left right here, you see a person with normal, healthy, a lot of blood cells. But on the right, with a person with thalassemia, they don't have as much. And thalassemia can also distort the shape of your blood cells. So like right here, it's more of a weird rectangle, whereas normally your blood cells will have a nice spherical shape to them.
So, thalassemia is broken down into a variety of causes and how severe it is. Thalassemia is a mutation. It's caused by a mutation of the DNA of cells that make hemoglobin. These mutations are passed down from parents to their children.
So speaking of the parent to the child, if one parent is a carrier of thalassemia, you are likely to be a carrier of the disease, but not have the symptoms necessarily. This is called thalassemia minor. But on the other hand, if both parents are carriers of the disease, you're most likely to develop the symptoms. Thalassemia is normally a recessive trait in the beta globin protein, and that is the genes that present but fail to produce hemoglobin adequately. A mutation in the beta globin is responsible for abnormal functions.
So, how much hemoglobin is being produced determines how severe thalassemia is. If half the amount of normal production is being produced, then you have thalassemia minor. If both genes fail, however, no globin is being produced, which means you have thalassemia major. Parents that have thalassemia do not have an exact answer to if their children will inherit the gene or how they will inherit the symptoms. For example, if a couple both have thalassemia minor, have four
They have four children. Yes, okay.
who have thalassemia minor and have four children, the probability for each child will be independent of what the previous child had.
So in this picture right here, these parents have thalassemia minor, so it's a recessive gene, and so one child will probably not have any thalassemia in them, while two can be carriers of thalassemia, and then one can actually only have the thalassemia gene.
So symptoms vary among people and depend on how severe your thalassemia is. These symptoms can include bone deformities, especially in your face, dark urine, delayed growth and development, excessive tiredness and fatigue, and yellow or pale skin.
So how doctors go about diagnosing patients, like most children can be diagnosed with thalassemia and show signs as early as birth or 2 years of age. So doctors can do a blood test to see if the patient has low levels of red blood cells or smaller than average blood cells or pale blood cells. And then the test can also determine the hemoglobin levels and the amount of iron in the blood. Prenatal testing can also be taken to see how severe thalassemia can be in the fetus. Doctors can test the fetus at 11 weeks, called chronic villus sampling, or they can do a test called amniocentesis around the 16th week of pregnancy.
So, depending on the severity of your thalassemia, treatment ranges from person to person. If you have thalassemia major, treatments can include blood transfusions, bone marrow transplants, medication or supplements, or surgery to remove spleen or gallbladder. As for people with thalassemia minor, most do not need to be treated but can include taking medication. So our case study involves a 36-year-old male of Burmese descent who had complaints about anemia and jaundice. He had chronically been diagnosed with jaundice and anemia since childhood, with multiple episodes of severe anemia requiring transfusion. He reported receiving more than 30 units of blood prior to age 17. The patient contracted hepatitis C secondary to blood transfusions he received in Vermont. Folic acid was his only medication, and he had no history of tobacco or alcohol abuse. His mother has thalassemia minor as well as one of his sisters. However, his father had no blood problems, my bad. He was submitted to a high-performance liquid chromatography I'm sorry. Okay. Okay, sorry about that. We were helping someone with directions. So the diagnosis of thalassemia is confirmed by fractioning HB using electrophoretic or high-performance liquid chromatography. The patient's presentation is more severe than that of his parents because the severity of disease is a consequence of the co-inheritance of both a beta thalassemia allele from one parent and an HBE allele from the other.
So now our phylogenetic tree. Let's move our heads so we have some pictures coming through. So of course, first we have Homo sapiens, us humans, and then we have our cousins, our pan-troglodytes, the common chimp. Next is the gorilla, which is obviously a gorilla. And then we have our Atlas peniscus, which is a red-faced spider monkey. And then we have a Macaca speciosa. What is that? A species? Stumptail? Oh no, that's not the.
Yeah, the stump-tailed macaque. Yeah, macaque.
Oh, okay. I'm sorry. And then we have the Macaca nemestrina. And what is that?
Our southern pigtail macaque.
Okay. And then we have the Chilothrix jactus. That is a common maramoo, right?
Yeah.
Okay. And then we have our Floricebus aethiopes.
Most known as a grivet.
Okay. And then we have our Halibat lar, which is
A
gibbon. And then the next one is just the Northern Plains gray langur. And so you can see all of these, we are very closely related to the gorilla and the chimp, where we have that common ancestor right there. And then they share these common ancestors with these monkeys, like these primates. And then we all come up to a common ancestor right above here.
So background disorder, the background to this disorder is there's either a thalassemia alpha or a beta thalassemia. Alpha thalassemia is caused by mutations in the HbA1 or HbA2 genes. Beta thalassemia is caused by mutations in the HbB gene. This gene provides instructions to make a protein called beta globin. It is a heterogeneous group of autosomal recessive genetic disorders characterized by decreased or absent synthesis of global chains. 5% of the world's population actually have thalassemia. It's a very common blood disorder. Each year, thousands of babies are born with beta thalassemia, most commonly in Mediterranean countries.
So you can see the difference right here between the chromosome of the beta thalassemia gene and the chromosome of the alpha globin gene. And so just how like how they're in different chromosomes, and then how like they can appear differently in humans. And so here are our sources, and thank you, and I hope you learned a lot about thalassemia today.